Hi, good morning. Dr. Fred Coville here, and welcome to our first webinar where I'm here to answer your questions and just tell you a little bit about what's new in beauty and rejuvenation and just ways that you can kind of feel good and look good. So we're going to answer your questions, and please feel free to hit the chat button and ask us some other questions. But basically, I'm yours for the next hour. So let's see. It looks like let's see what we have. We had a couple of questions that came in. So the first one we have from Donna B is what's the difference between silicone and saline breast implants? That's a great question. So silicone, well, let's start from the beginning. So all breast implants, actually, if someone could get me an implant, that'd be great. But all breast implants are have a silicone shell. So the outside of a breast implant is exactly the same, whether it's a saline filled implant or a silicone gel filled implant. Those are the only two types of implants that are approved for use in the United States right now. So the shell is exactly the same, and I'm going to show you that there are smooth ones and textured ones, which we can talk about. But the difference is the inside of the implant. So on a saline implant, the saline implant is basically, and here we have two different implants. So this is what a saline implant looks like. We have air in it, so there's no water in it. But you can see the outside is a silicone sheet. There's a little valve here, and what we do in the operating room is fill this with salt water. That's saline, and um, and that gives it the volume. The silicone gel is that same shell. Now this is a textured implant, and the inside of the implant is filled with I like to use Sientra implants, which we can talk about. But the gel inside is a silicone gel, which is what we call a cohesive gel. So that means that if I cut this implant in half, it will stay together, almost like a piece of brie cheese. It's exactly like that. So when you cut a piece of cheese, or think of one of those little Gouda cheeses, right? You cut through the red bit, the red wax, and the inside has cheese which doesn't separate. So that's the same thing with these silicone gel breast implants. Like I said, I like to use Sientra. It's a company made in America. There's only 3 breast implant companies currently in the United States. Another one is coming on, but I think Sientra makes some of the best implants. Their gel is really, really nice. It's a nice, natural feeling texture, and they make, I think, for my opinion, the best breast implants on the market. They are only available to board-eligible, board-certified plastic surgeons, so not everybody that does the operation can use them. They protect their implants, so they're only used by qualified surgeons. So the actual difference, the reason why I prefer silicone gel to the saline, the biggest difference is that this is basically a water balloon. That means when you fill it with water, that water can move inside. And what it does, it can stretch out the skin a little bit over time. So you get sort of the breast can flop to the side. These were what we used in this country for a long time because there was a controversy about silicone gel. But at this time, I find very little use for the saline breast implants unless somebody really, really wants it. Because as you can also see, there's some wrinkling on the edges. See that there? So sometimes you'll see those little wrinkles show through. And like I said, silicone gel looks more like a ball on your chest. It's not as natural. Whereas the silicone gel, the gummy bear implants, which we like to call them, they actually look more like a natural breast when you see them hang. See how it looks more like a natural breast? They hold their shape better, they stay where you put them, and they look and feel much nicer. There's very little risk with these, as there are with these. There are some differences in the texturing surface as compared to the smooth surface, but that's sort of, I can always talk to you about those differences another time. But that's it in a nutshell. So the saline implant is basically a bag full of water. Silicone gel is a same bag filled with silicone gel, gummy bears. And this is my preference. These are my go-to implants. When you have a consultation with me, I can go over them, you can feel them, you can touch them, you can see how they look on you. But uh, that's really it in a nutshell. Okay, so that's our first question. Let's see. Who do we have next? Ah, okay, so we have a guy. That's always nice. You know, people always ask me a lot is, do I only operate on women? And do you only operate on men if they're doing something reconstructive or if they got in an accident and we fix them up? But the fact is that plastic surgery among men is becoming much more popular. And we probably almost 25% right now, maybe 30% of our patients are men. And men get Botox, we call it Botox. They do get fillers. They do get liposuction and body sculpting, and they do facelifts and eye lifts and all those things. So men are much more concerned about their appearance, especially the professional man that is out there in the public that needs to be concerned about his appearance. Um, the days of having a stigma against this sort of thing are sort of long gone, and I think men feel much more comfortable having little procedures. And we are very discreet. One thing I've learned over the years is men are a little bit shy. They don't really like to admit that they want to do something, but we make it very comfortable for them. We really are very discreet in terms of privacy and making sure that they don't feel uncomfortable. So it's a big thing. So let's see what Mike has to say here. Mike asks, I lose weight. I've been working out, but my chest area is still very large, embarrassingly so, almost like a woman's drooping breast. Well, Mike, that is a very common problem, and that is called gynecomastia. So gynecomastia is actually a breast gland in men. Now, everybody, regardless of sex, has some amount of breast tissue. Um, Men have very small breast tissue. They may have just a tiny little bud, but every man has some amount of breast tissue. Now, some men, even from a young age, will develop enlarged breast tissue. We say that breast gland becomes hypertrophic or too large. So that can happen from all kinds of reasons. Sometimes it can be a hormonal thing. It can just be a genetic thing. Um, as you get older, it could be from taking certain medications. So, for example, someone middle-aged that's been being treated for high blood pressure may have some medication that may make that breast look larger. But also, you have our gym rats, and some of those people like to take some supplements to help them put muscle mass on, some testosterone or steroid supplements, and those things can have that side effect of creating breast tissue. So the biggest thing I want you to understand, guys, if this is something, or Mike, thank you for the question. This is a really important question, by the way. But the biggest thing you need to understand is that this is not abnormal. There are a tremendous amount of men in the world that have this issue, and it can be quite devastating for a young boy. When it starts to happen at the age of 12 or 13, when boys are going through puberty, and they start to have abnormally large breast tissue, that can be pretty devastating. They don't want to take their shirt off. You'll frequently see it on the beach. You'll see guys that don't want to take their shirt off. They never want to pay a skins and shirts game of basketball because they don't want to take their shirt off. They're embarrassed about the way they look, and they think that they look abnormal. And what will happen many times, especially in those young boys, they'll actually put on weight trying to mask the amount of breast tissue that they have. And that's really a shame because they're carrying extra weight just to make their breasts look a little bit smaller in relation. So you see these chubby little boys, sometimes they're just trying to hide this breast tissue. So the answer is it can easily be treated. It's not a massive procedure. We make a very small incision, and in 90% of the cases, it's a very small incision. And I need you to understand this one thing. You cannot treat this with things like cool sculpting or straight liposuction even. You cannot treat it by going to one of these physicians that will just clamp something on, because what is causing the swelling there is not fat. There may be a little bit of fat around it, but what it is breast tissue. And if you don't take that breast bud out, it will only come back, or you will be left with a breast tissue there. And the cool sculpting or sculpture, any of those things that you clamp on there will cause that area to become much more scarred, and then it becomes even more difficult to come out. So you need to understand this. Please don't be suckered into this idea that you can just go and someone can put something on your chest and they're going to get rid of it. Most of those people that are selling that don't understand gynecomastia. Gynecomastia is abnormally large breast tissue, not fat. Yes, you can maybe treat some of the fat that might happen underneath the arm, but you'll never get rid of the breast without taking that out. It's a very simple operation. Make sure you choose someone that understands this. But Mike, I got to tell you, this is a great operation. It will change your life. So tiny incision right around the nipple. Go in, we take out the breast tissue, sculpt the area, make sure the fat is gone, and then your skin will shrink down and show off that pec that you've been working so hard to develop. All right, it's going to look great, and women will love you at the beach. All right, so what do we have next? I hope that answered your question, by the way. Oh, here's a good one. We just talked a little bit about that. Teresa, what's the difference between cool sculpting and sculpture? Great question. So, non-invasive fat removal is what we're talking about. How do we get rid of fat without causing you to have any operation or a scar? So the market leader, as everybody knows is Cool Sculpting. They have the best advertising. They are spending tons and tons of money to get you in there, and they sell those machines to all kinds of docs all around the globe. So they are selling a ton of it. But does that mean it's the best? And I'm here to tell you, no, it doesn't mean. All right, so just because someone has great marketing doesn't mean that they have the best procedure. So I'm not saying it's a bad procedure, but I do think there are better ones. So I'm going to tell you the differences. So the two major players in this space are Cool Sculpting and Sculpture. There are some others that are coming on board, and the idea is how can you dissolve fat without causing an incision or without having to go under anesthesia. So number one rule, it's not for everybody. If you have really bad skin or if you're looking to lose a tremendous amount of weight, no amount of Cool Sculpting or sculpture or anything is going to make a difference. All right, it's not going to make a difference that you're going to be happy with. So it is meant to sculpt. That's why both of those products have sculpt in their name, because it's meant when you have a fatty deposit, whether it's in your belly, whether it's in your flanks, in your love handles, or in your lower belly, wherever that is, even under your arms, here in your neck, then we can dissolve a certain percentage of fat cells in a short period of time. Now, Cool Sculpting uses cold to do it. Sculpture uses laser heat. Okay, that's the difference. Cool Sculpting will chill the area. Let's say you did it under your arm or around your flank. So you'll clamp this thing on, and it sort of sucks the fat into that. And between this little paddle, that skin will be chilled. Almost imagine that you're sort of freezing in a North Pole expedition. So that area gets cold, and then when you're finished with that, sometimes it can hurt a little bit, and it can cause some numbness. But when that area when you take it out of there, over the next 6 to 8 weeks, the FDA says you will lose about 24% of the fat that is in that area, okay? Now, Cool Sculpting is limited by the amount of area that it can treat, so it doesn't sort of feather out. Sculpture, on the other hand, uses heat, and it uses a flat paddle where laser energy is put on. It'll get warm underneath there, just gently warm, and it'll sort of get warm and cool over 25 minutes. Cool Sculpting takes about an hour, like I said. This takes about 25 minutes, and it will also spread. So it will also kill that 24% of cells underneath it over 6 to 8 weeks. And then you can retreat. Usually we recommend at least 2 treatments per area. So it's a quicker treatment. There's no cold, there's no pain, and there's no massaging it out, because the cold one you have to sort of massage the stick of butter out. And there's no chance of having numbness afterwards. The biggest difference I find is that sculpture, because the energy sort of feathers out from where you put the paddle, there's a smooth transition. You can get divots and sort of indentations with Cool Sculpting because it can only treat the area that it is over. It doesn't spread out. So you can get little irregularities. And the other thing that can happen, which is actually not uncommon, is this thing called paradoxical hyperplasia. So that means that for some reason, when you chill the fat, what people think is that your body interprets that you're cold, so it actually makes more fat. So there are patients that get these large growth areas of fat from the Cool Sculpting that have to be liposuctioned out. And that's sort of a weird benefit that you should, and it's not a very easy kind of fat to take out. So cool sculpting can have its side effects, pain, numbness, and this paradoxical hyperplasia. Cool sculpting really doesn't have any side effects. In 25 minutes as opposed to an hour, you can treat multiple areas at the same time. It removes the same amount of fat, 2 treatments, in and out, and you go right to the gym. You do whatever you want in a very short amount of time. So that's the biggest difference. So my preference is sculpture. Okay, thank you, Teresa, for that. Chelsea says, what are my options for skin tightening? So skin tightening, the holy grail of plastic and aesthetic surgery. Everybody wants skin tightening. Nobody wants to pay the price. So I've been doing this for just about 30 years. When I was a young surgeon, just out of my training, which by the way from Mount Sinai in New York, wonderful plastic surgery program. So back in those days, there was no Botox, there were no fillers, there were no lasers, there was no radio frequency, there was none of the things that we have available today. The only thing that we had was my scalpel. So basically, everybody that came to see me or any plastic surgeon got an operation. We used our scalpel. So skin tightening meant making an incision, pulling it tight, and closing it. So sometimes that worked beautifully. Sometimes it worked great on tummy tucks and breast reductions and some facelifts. But it was the only tool we had, and not everybody needed that aggressive a tool. So as time develops, really starting in the early to mid 90s, we first had the introduction of Botox to treat wrinkles. Then we started to have some fillers, which could restore volume. Then we had things like lasers, which could smooth and tighten skin, and radio frequency. So there's been a progression of different technologies that we can use. However, the most disappointing treatment that we have that will tighten skin without causing you any downtime, and that's the key, downtime. There are many, many products out there. The fact that there are many, many products that do it should let you know that no one thing works that great. Okay, so really that's the option. So when someone says that, there's 5, 10, 15 different machines out there that will rejuvenate your skin, then that tells you the fact there's so many of them means that nobody's doing that great a job. So there's all different kinds of ways to do it. When it comes to surgery, we know, for example, my scalpel is the most dependable tool I have. I know exactly what it's going to deliver, and I know that I can deliver what I ask it to do. So the best options for tightening, like I said, there are lasers. Some lasers will cause some downtime. There are non-ablative lasers. They have minimal downtime but require many more treatments. There are chemical peels that do wonderful jobs of smoothing and tightening skin. Then there are the new radio frequency machines. Some of these radio frequency machines or ultrasound machines promise things that they can't deliver. There are machines that I really don't like, and I know a lot of people spend a lot of money on these. Well, therapy is disappointing. There are others that are a little bit disappointing. So what I want you to understand is that please do your research, really speak to a surgeon that understands all the technologies, and don't be sucked into a treatment just because that's the machine that they happen to have bought. And that is the trap that happens when there are so many options. There are doctors out there that will buy machines. They have to make their payment on their machine, so they have to channel you into that machine. So for example, if you go to a practice and all they have is cool sculpting for fat removal, but they don't know how to do liposuction, they don't know how to do tummy tuck, then they're going to sell you cool sculpting no matter what. You may not be the most appropriate patient for that, but you will be sold a package of cool sculpting. Whereas when you come to a plastic surgery practice like mine, where we have all the tools, it makes no difference to us if you buy a sculpture package, if you buy liposuction, smart lipo, tummy tuck, it doesn't matter. We're going to offer you the best procedure. Same thing with skin. I've been doing skin 30 years. It's one of my passions. So I can do chemical peels if that's right. I can give you laser treatments if that's right for you. I can do radio frequency tightening if that's what you need. PRP, microneedling, fat transfer, anything, including a most spectacular face and neck lift with the tried and true scalpel Those are all things that I can offer you and any good plastic surgeon can offer you. But when you are limited by your training and your experience and you only have certain tools, then you're going to be pushed into one treatment or another depending on what they sort of invested in. So it really is important for you to go to someone who has the entire package, not just some packages. And it also depends on their experience. Believe me, when it comes to skin tightening, especially in the face and neck, that is sort of that's the most demanding part of our specialty. So you want to go to someone who's done a lot of facelifts, who understands the nuance of creating a face and understands how to combine things like good skincare, microneedling, dermabrasion, microdermabrasion, chemical peels, radio frequency, all of these things. Think of them like ingredients when you cook. You know, nobody cooks with just salt. You have different spices that you put in, and depending on how you mix those spices, are going to give you the result that you want. So we're always trying to get this most natural, beautiful result. Okay, so it's not an easy answer, and I don't want to make it seem more complicated than it is, but believe me, skin tightening is one of the things that we do, but depending on your skin type, what your needs are, and what you're hoping to achieve will determine which treatment we think is the best. And we do have all the options available to us. Okay, so thank you for that question. How we doing? You guys all right out there? All right. So, here is another one of these issues that women, and this is one that doesn't apply to men, women really are troubled by, and that's cellulite. So, she's starting to get cellulite. Her name is Rachel. What can I do to prevent and treat? All right, we'll do the prevention first. So, unfortunately, prevention is a mixed bag because nobody exactly knows why some women get it more than others. We do know the anatomy of it. So, if you think about your mattress at home, right? Take the sheet off, look at the mattress. There's a lot of little buttons with little pin cushions, all right? That is cellulite. So what happens is you have those areas of the mattress which are sort of acting little pillows, right? They sort of little bumps. That is fat poking through, and you have these button areas, which are little bands. Think of them like little rubber bands of tissue that are pulling the skin down and attaching it down to the deep part of the skin. The reason women get cellulite and men don't is because women have these sort of parallel bands of fascia. I know it sounds a little weird, but basically everything is sort of like this. Men have a crisscross pattern, all right? So fact is, it's one of the few things. Men can't get it, women can, but women, you live longer than we do, so I think it's a pretty good deal. So you get cellulite, we die sooner. So, but here's the thing. So when that fat sort of pillows up, we need to deal with that. We also need to deal with the dimples and the depressions, and we need to deal with the bands. So why do you get it? Some women are predisposed to it. Some women have it at a very early age. Other people never get it. But you can improve it. Number one, don't always walk around in high heels. You need that pumping action of your foot to be pumping blood back and forth. When you walk around in heels, you're sort of walking on your toes all day. You don't get a full motion of your calf. So you're not really circulating blood and fluid through your leg as efficiently as possible. That sort of predisposes to swelling, okay? So heels, I'm not saying never use them because I love the way you look in your heels. Everybody does. You know you look good, but you got to give your feet a break, wear flats once in a while, okay? Or go to the gym and do some real exercises with your legs. The other thing is more protein in your diet has been shown to help. So women have a real problem with protein. I know if you're a real gym person, sometimes you watch it, but women always are reluctant to take a lot of protein. They're pretty good with fruits, vegetables, carbs, but protein is one of those things that will help you decrease the edema or the swelling in your legs. So it is important to take enough protein in your life. And that means a little bit of meat, fish, eggs. You got to do it. You know, I know you always want to have your salad, and you know that's good. Maybe that's why you live longer, but you got to add some protein as well. Okay, that's the best I can do on prevention because nobody has a great way to prevent it. But on treatment, I do have some options. So the best options are laser treatment, which I love to use, which is called cellulase. So cellulase will take those pillows of fat down. It will cut those bands that are puckering the skin, and it will use the laser energy to tighten the skin above it. So that's a really nice treatment. It's one that I love using, and we do it under local anesthesia right here in the office. It's a beautiful treatment, and it's the one that I can really predict, okay? There are others that, for example, will cut the bands. There's a treatment out there that will cut the bands, but does nothing to deal with the skin or the fat or any of that. So they can help with the dimples, but they don't help with the pillowing and all that. So other than that, I have to tell you, there's not many good options. So cellulase is the best option. I believe in it. I use it. And for the right person, it's the right treatment. Everything else is disappointingly inadequate. And that's just the way it is. I guarantee you that there's going to be technology down the road. It may take a few years for it to develop. And I have a lot of confidence that human beings are really good at developing technologies to take care of problems. And this is a problem that so many women suffer from. So I think there will be better. But right now, the state of the art is the cellulase laser technique. Okay? All right. Where do we stand here? We got another question. Remember, you can call in and chat and be happy to take your questions. Who do we have? Cassandra. Oh, my butt is super flat. What can I do? Well, Cassandra, you happen to be living at the era of the butt. Okay, so like I told you before, yeah. So like I told you before, I've been doing this for almost 30 years. Now I will tell you that we have changed our perception of the butt over those years. So when I was a young surgeon and first starting out, and I was doing a lot of liposuction, and believe me, I was suctioning fat from saddlebags, banana rolls. I was even suctioning fat from butts, in addition to waist. But that was a tremendously popular procedure. Liposuction in those days, especially in the early mid-90s, was the #1 cosmetic procedure around the world. Still is up there. It usually switches between breast augmentation and liposuction. They sort of fight for the top surgical procedure. Botox and all the neurotoxins are #1 in all procedures. But let's go back to the liposuction. So those areas where we would take fat out, people wanted a athletic, no hip kind of look with not a very big butt. And then who came into the world? Good old Jennifer Lopez. And J-Lo started it all. Anybody else can claim it. People will talk about Kardashians and all that, but it was J-Lo that set the stage for it. People saw someone that was a full-figured woman, still athletic, still incredibly sexy, and people wanted that. And it just has grown and grown and grown, literally, in popularity. And people love a full buttock, especially if you had one and you started to lose it. So then people want a little bit of fullness to give that youthful look, and other people just want to shape the butt. So think about this. You know, people always think about your face. Oh, I worry about my neck. I worry about my eyes. But you know what? You can spend a lot of time if you're a male or a woman looking at someone. You can actually spend more time appreciating their beauty from behind than you can from the front. You know, you can see a beautiful, shapely buttock, walk down the street, follow them into the Apple store, and get a good, nice look without anybody thinking something's up. But you stare at somebody's face and it gets a little freaky. You know, you're just a little creepy. So really, this is something that's been around for hundreds of thousands of years. Or thousands of years, tens of thousands of years. So the buttock is an underappreciated, or has been an underappreciated asset. Probably where the word asset comes from. But so when you spend time understanding attractiveness, and we're talking about both men and women because we do butt augmentations on men as well. People like a healthy, shapely buttock. It is an attractive feature that we need to pay attention to. So it's nothing to be ashamed of. So what are the best methods to do it? There's basically two: buttock implants and your own native fat. Sometimes we have to shape it with a little surgery, but most of the time we're talking about fat or implants. I'm not a big fan of implants, mainly because of the limitations that we have in this country with implants that are the type of implants that are approved. There are some in other countries like Europe that are a little bit better, but they are not approved yet. We still have to see how they handle over time. So the implants that we have in this country are nice, but they're solid sort of silicone. The implants that they have in some other countries are a little bit softer. Fat is a wonderful option, provided you have enough of it. So we take fat from one body, you get the benefit of sculpting, say, your waist or your flanks or your thighs, and taking that fat and transferring it to the buttock to give you a nice, shapely buttock. And that fat, the benefit of transferring fat, whether you take it and put it in your buttock or put it in your face to give you a nicer look, like you can look here, you know, I was deflated a little bit, so a little bit of fat will make me look a little younger. Look at the difference over here. So when you transfer fat, you get the benefit of filling up the volume, creating a nice shapely buttock, but also you get stem cells. And those stem cells, over time, we've noticed that 6, 8, 12 months after you have the fat transferred to your buttock, the skin over the area that you transferred becomes younger. It actually rejuvenates. So it's a wonderful thing to transfer fat from one place to another. My own opinion is that as the years progress and we get some different options for buttock augmentation, you're going to see that the combination of fat with buttock implants is really going to be the best way to go. So right now, I say fat. I don't like the implants that are available. They shift, they roll, they turn. So I don't like that procedure right now. But I do think that when better implants become available, and then we can combine that with some fat, that's going to be the holy grail. But I do know that right now, fat is the way to go. So I really think that fat transfer gives you your own tissues that will grow and give you a very natural appearing buttock. And you can see tons of these options on our website and other websites. It's a procedure I like to do because people are incredibly happy with it. Okay. Okay. Let's see. We have Amanda. Okay, Amanda is pretty emphatic here. I hate my chin and neck. The sagging skin and lines help. Okay. All right. So here we go. So skin and neck on your face. There are so many issues, and you know, as I said, I've been doing this for about 30 years, but I've spent most of my life as an adult or even as a young adult studying beauty. And it's really essential that I think whoever performs any of these procedures really has a great understanding of what makes people attractive. So I don't believe it's something you can learn just overnight. And I don't think that going to people that haven't spent their life doing this is a great idea. And I really mean that. I know I'm biased because I'm a plastic surgeon, but believe me, I spent many, many years. Plastic surgery, fully real plastic surgeons train the longest of any surgical specialty. We spend a tremendous amount of time perfecting our craft. Not only that, but I don't believe you can be a good cosmetic plastic surgeon unless you're a good reconstructive plastic surgeon. You have to understand the anatomy. So no, going to your internist, going to your dentist, going to someone who calls themselves a cosmetic surgeon that didn't have a proper American Board of Medical Specialties residency really makes a tremendous difference. There is no substitute for experience. It simply isn't. And so that said, wrinkles, sagging skin, it's sort of not even addressing the right problem. As we age, yes, you do have sagging skin that happens. You do lose skin tone. But that was what we thought back in the day. Okay, so that was the only thing. So when I was a young surgeon, yes, we had a scalpel, we'd make an incision, and we would pull this as tight back as we possibly can, trying to obliterate any lines, wrinkles, or whatever, and just pull the skin as tight as we can get it, and really yank on that, and create a very flat, sort of, fishy look, and mouth was spread out. They looked like they were in a wind tunnel, and everything was going wrong. You had your eyebrows up around your hairline, and yeah, you look tight, but did you look young? And I got to tell you, we didn't. I remember one of my professors, really great man, one of my mentors, his name was Bernie Simon, great plastic surgeon. He says, when I learned to do a facelift, he said, Fred, it's not a great operation. I don't know if anybody would be doing this operation if they didn't pay us so much. So what I was saying, a traditional facelift really addressed tight skin only. That is not the facelifts we do now, because we understand aging so much better. So yes, we have some laxity in skin, but we also have deflation. Think about a balloon. It's really inflated and young and beautiful, and then it sort of loses a little bit of air and it just starts to look like a little floppy piece of latex. So that's what's happening here. We lose some volume because we lose bone when we lose fat. So nowadays what we do, we work on the skin to tighten it, make sure the envelope is as healthy as possible. That means skincare, maybe a little bit of chemical peels, maybe a little bit of laser, but we get your skin looking as beautiful as possible. We re-inflate with volume. That could be fillers or it could be fat from another part of your body. And that all of a sudden starts to make everything look better. Then if you really have a bad neck or if you have really hanging jowls, then we add the surgery, the facelifts. And that will go up, not back like we used to. We go up and replace it where it used to be. And that creates a very youthful, healthy look. Youthful and healthy look. So neurotoxins like Botox, Dysport, Xeomin, those are other wrinkle reduction creams. So you see these lines I have here, like the big Sharpay? Those things, we relax those lines so that your forehead becomes smooth. You don't get to do these angry frown lines. Yes, I do need some Botox. I need to treat myself. But we get rid of those things that are dynamic wrinkles. We treat the skin with different modalities, sometimes esthetician treatments, just to get your skin as healthy. We inflate with volume if that's what you need, and we tighten skin and reposition. So there are many options, and depending on your particular need, that's how we tailor it. So there's never one size fits all when it comes to rejuvenation. And don't be suckered into a dentist, for example, that's giving Botox as a special. Let them stick to their teeth. Don't be suckered into a general practitioner that all of a sudden wants to be a cosmetic doc. This is an art, it's a skill, but it's also a medical surgical specialty. And you have to understand the anatomy. You have to understand how things work. And you can't just walk in and have someone put a bunch of needles in your face and tell you you're going to look younger. You're going to look injected, but you're going to look better, or you're going to look really younger. That's what you really want. Okay? How are we doing here on time? Last question? Okay. All right, last question. PRP. What is this PRP thing that I keep hearing about? That's from Linda. Okay, so PRP means platelet-rich plasma. Some people have heard about the vampire facelift or the Dracula lift. Those are basically platelets are in your blood. Turns out that those platelets have a lot of growth factors. So what we do is we take blood from an arm, we spin it down, take those platelets out, take the what we call platelet-rich plasma, PRP. So we have that plasma, which is chock full of good, juicy, healthy platelets with growth factors in them. And then we can put them in your scalp to help hair growth. If you have thinning hair, women and men, we can put it into your facial skin to help your skin heal itself from the ravages of the sun, wind, time. So it starts to rejuvenate just by putting in the PRP. Sometimes we'll combine with the microneedling because the microneedling helps to make that penetrate. Or we can even mix it in the fat that we transferred. So you have the stem cells from the fat plus the growth factors. That's a sort of 1-2 punch that really works wonderfully. But I'll mix PRP with lasers or whatever, or as a standalone procedure. But basically what we're doing is we're transferring those youthful, healthy growth factors, putting them into a place that makes a difference. For example, orthopedic surgeons, they'll put it in shoulders, they'll put it in knees to try and help heal ligaments. So what we're trying to do is heal your skin, heal the tissues, and give you the growth factors so that you can rejuvenate. So that's why they call it vampire look, because they're taking blood and making you look younger, because you all know that vampires never age. So I think unless we have any other questions, I think we've done pretty well today. So I hope I've answered your questions, and I hope you'll join us again for our sessions, and we're going to make these available to you on our website. So have a great day. Thanks for joining me, and hope to see you here at Cortisone Plastic Surgery.